Our very first speaker is Dr. David McKeown, who is the Medical Officer of Health of the City of Toronto and Executive Officer of the Toronto Board of Health. He leads Toronto Public Health, Canada's largest public health agency, which provides a comprehensive range of public health programs and services for 2.6 million residents. He is a community medicine specialist who has worked in the public health care field for over 20 years. Dr. McKeown has been a vocal advocate for public policy to address important public health issues such as air pollution, food marketing to children, and child poverty. Dr. McKeown.
Thank you very much, John, and good morning. Delivering appropriate and effective local health services requires accurate local information. The long-form census is an essential source of information about local populations, which we in Toronto Public Health use day to day. Toronto Public Health and other health service providers rely on the information from the long-form census to make decisions which affect the health of people in this city. Data on immigration, on ethnicity, language, education, employment, income, transportation are vital to our work, and we've made extensive use of this information over the years. We also make good use of research which has been undertaken by others using data from the long-form census, which guides the design of our programs and services and enables us to target them to those who can benefit most. Now, the proposed voluntary national household survey is not in any way a substitute for the mandatory census. Over the past decade, the proportion of people who respond to such voluntary surveys has been decreasing. For example, in Statistics Canada's own Canadian Community Health Survey, the response rate fell from 70% in 2001 to 65% in 2007. Those who do respond, we know, are more likely to be white and middle income. Those who are less likely to respond, including low-income earners, Aboriginal peoples, and newcomers, are also those who are at greatest risk for poor health and those about whom we need information most. Voluntary surveys, such as the Canadian Community Health Survey, play an important role, and they'll continue to play an important role. But our ability to understand the biases that are present in these surveys and to correct for them actually depends on the comprehensive data that comes from the mandatory long-form census. Health status and health service needs vary from city to city, and they vary from neighborhood to neighborhood. Factors such as income, immigration, ethnicity, employment, education are powerful determinants of people's health, particularly in diverse communities like Toronto. High-quality, consistent information from the long-form census is an essential tool in local health service planning.